speaking of masks, does this protect me? Or does it just protect other people? Let's find out.
That's terrifying.
Okay, there's a couple of things we need to learn about the mask. First off, the first thing is you have to remember what inhalation protection is and exhalation protection is. Okay, just remember that. Two things to a mask. All right, so the first type of mask is these cloth stretchy face mask. Will this protect me from getting COVID-19? No, because it doesn't stop that much coming through. I can still get it. Does it reduce it? Yeah, okay, maybe. Don't know. That's inhalation. Exhalation. I can breathe smoke through this. If I cough, droplets still come out. It doesn't really protect anybody either way. Let's forget that one. All right, the next one is this mask. I'll put a pop up here. It's called a dust mask. That's for filtering out large particles that are floating around while you're sweeping. Some people try to use it for painting so you don't get, you know, the black stuff or gold or whatever color you're painting with on your face, up your nose. You can still smell the paint fumes, but you don't get the large particles coming through. The next one is this one, which most commonly people know as the N95 mask. It's not, the mask itself is not called an N95. That's the material that it's made out of, okay? It filters out roughly 95% of the particulates in the air. That answers the question right there, 95%. Does it protect you? No. If you cough, it leaves your mask. So it doesn't necessarily protect people around you. Now let's get the other thing straightened out, is that supposedly the droplets in the air carry COVID-19, right? And it stays in the air for X number of minutes. I think somebody said 15 to 30 minutes, it stays in the air. So if you cough and some of the droplets get into the air and you are walking through a grocery store, you will walk right through the plume of droplets that you or somebody else coughed into the air. So it doesn't protect you going out. It will not protect you to go in. Inhalation, exhalation, right? Will it reduce it? Yes, probably. If you wear that and you stay 6 feet away, you have a better chance. But if it stays airborne for 15 minutes, even if the guy's 30 feet in front of you and it takes you 10 minutes to get to the plume that he left behind, it's probably not going to protect you. Okay? The next mask, this one. This is kind of like your dust mask or N95 that some of you guys are calling it. It has an exhalation valve on it, which means when you breathe in, it goes through the 95 or N95 type of media filter piece. But when you breathe out, it allows your exhalation to go out the exhalation valve. This may protect you a little, but protects nobody around you. Anybody wearing a mask that has an exhalation valve on it is not protecting anybody that stands around them. Now, I've seen some of these masks being worn at, you know, different places, and they're nice looking masks, but they do not protect anybody around them, and it offers you little protection. All right, The next one. Now this one's an actual tight fitting half mask respirator. Half mask respirator. Now if you put the pink magenta P100 type filters on it, it will definitely protect you against the COVID-19 virus. But it has an exhalation valve, which means when you exhale, your droplets go into the air. So therefore, people walking behind you, walking around you, are going to catch it anyways. Now let's talk about the most common mask, the surgical mask that you see that has the loop things over the ears that are made out of several different types of media. And you say, well, Rogue, you know, if the surgeons wear it, hence surgical mask, surgeons wear it, it must be just fine. It protects everybody. Does it? So labs done testing, everybody's done testing on them, and yes, if a surgeon is wearing this mask and he's bent over your open body that he just, you know, cut open with a scalpel, it lowers the risk of him, being the surgeon, contaminating your body from the spit or saliva or sneezing or, well, I can't say sweating because sometimes it doesn't cover their forehead, sometimes it does. And then they wear a face shield. That is to protect the patient.
This is what it looks like when someone coughs into their hand and into their elbow. And this shows the travel of air particles when coughing while wearing two types of masks, a dust mask and a surgical mask.
Does it work 100%? Nope. So CDC, we'll see what they say. I'll bring that up. We'll look at the labs. It is kind of funny. So one of the labs I was looking at, I'm trying to remember what lab it was, he actually had to hot glue this mask down to the platform just to get a good seal, because loose fitting respirators or dust masks are not a tight fitting face piece. And we'll look to see what OSHA says about that. All right, see if I can read this real quick. Since you don't have to believe me, I'm going to try to figure out how to leave the links down below, so that way you can go read it for yourself right from the government agencies. All right, so from the CDC, it says COVID-19 can spread by people who do not have symptoms and do not know that they're infected. True. That's why it's important for everyone to practice social distancing. Okay, sort of agree with that, I guess. And wear a cloth face coverings in public. Cloth face coverings provide an extra layer of protection, extra layer to help prevent respiratory droplets from traveling in the air of the people. Extra layer of protection. So in other words, not 100%. All right. Mayo Clinic. So that was the other one. Mayo Clinic, that's a big one. They know what they're talking about. So let's see what they say. The Mayo Clinic. Some N95 masks and even some cloth masks have a one-way valves that make them easier to break through. Remember we talked about the differences between the masks. So the ones that have exhalation valves don't do you any good. But because the valve releases unfiltered air when the wearer breathes out, exhalation, this type of mask doesn't prevent the wearer from spreading the virus. That's right from the Mayo Clinic. For this reason, some places actually have banned the respirators that have the exhalation valves. What does FDA say about it? I don't really care about the FDA. I don't care what they say. But anyways, FDA says masks are loose fitting and may not provide full protection from breathing in airborne pathogens. True. Such as viruses. Face masks, like non-surgical masks, may not provide protection from fluids or may not filter particles needed to protect against pathogens such as viruses. So they don't work. They are not for surgical use and are not considered personal protective equipment. So the ones that go behind your ears don't work either. Publication from OSHA says, prevent worker exposure to COVID-19, makes no mention of wearing masks for transmitting COVID-19. I'm telling you guys, don't have to believe me, go read it for yourself. Educate yourself, remember? All right, USA Today. USA Today publication says they claim that non-respirator ear loop masks are ineffective from protecting against the COVID-19. That's partly false based on our research. So USA Today did their own research, I guess. It is true that the ear loop type masks do not protect the wearer from COVID-19, but it is false to say that they offer no protection. So it does help a little.
To make it plain here, Stray, I have one surgical face mask here between the two of us, between me and Tom. He's sick, I'm not. Who should get the mask? Well, your natural instinct is to say, give me that mask. I don't want to catch what he has, but I should be begging him to wear it because him, the sick person wearing it, better protects me, the healthy person, as if I were wearing it myself. So all these masks are floating around out there. Which ones do health officials say you should use? None of them.
They are warned to protect others from the virus and limit the spread to public settings. The warning of the packaging of the mask does not imply the masks do not slow the spread of the disease, but rather the mask does not protect the wearer. Sorry, ear loop masks do not protect the wearer. So I'll try to get those links on here so you can read it for yourself, educate yourself, so at least you have an understanding if these masks work or do not. Don't know what to tell you guys. Read it for yourself. Thanks for watching Rogue M4. Make sure you hit the like and subscribe button, and I'll catch you next time. Thanks. Bye.